Good afternoon, everybody. My name is Hannah Batesh. I'll be your moderator today. Um, I am very excited to be hosting today's session. This is one of the NARS virtual conference meetings, and I'm a senior associate at APT and a member of the NARS virtual conference planning committee. So for today's session, we have what I think will be an excellent set of presentations on machine learning in human services contexts. We'll start today with a few webinar housekeeping reminders from Jean Goodman in FIT department, and then Lauren Antello, who chairs the NARS Virtual Conference Planning Committee, will provide some background on NARS and on the virtual conference. And then I'd like to do some quick polling to understand more about who all of our audience members are before we move on to our panel presentations, and then we'll have plenty of time for Q&A. So Jean, I'll turn it over to you.
Thank you, Hannah. Just a couple of quick things. I know you have been watching this presentation already, but I do want to make certain that you know how to connect to the audio of the meeting. And I will also let you know, oh dear, this is the problem of having cats in the household. I apologize. I will also let you know that if you want to connect to the audio of the meeting and you've clicked on that little phone icon, you can change how you're connected. If you have already chosen a method, you can use the 3 dots icon and audio connection in order to switch. And if you will notice, if you see this icon at the bottom, that is because all participants are automatically muted. If you would like to ask a question, you can go to the Q&A box on the right-hand side and send a message to all panelists, and they will be addressing those questions in time. And if you would like to change the display, find this icon in the top right-hand corner, and it will allow you to change your display to be something that may be more helpful to you. With that, I'm going to hand things back to Hannah.
Thanks, Jean. So I'm actually going to hand things to Lauren to talk more about NARS and about the virtual conference.
Thank you, Hannah. So as Hannah said, my name is Lauren Antello. I'm the Associate Director for Strategic Initiatives at the Administration for Children and Families, and have the pleasure of serving as the co-chair of the Virtual Events Committee for NARS. This is our 6th webinar of the 2020 NARS virtual series, and we're just so excited to be partnering with APT Associates. NARS is the National Association for Welfare Research and Statistics, and it holds in-person conferences every other year where human services researchers, practitioners, and policymakers come together to talk about their work and how it can inform policy and practice. Several years ago, NARS began holding virtual events in the years when the conference wasn't occurring. And these events have represented an opportunity for us in the NARS community to remain engaged and highlight interesting research and trends that are relevant to our membership. Before we jump in, I wanted to take this opportunity to just put in a quick plug for our 7th session, which will be occurring later this year on cross-system collaboration for serving justice-involved clients. We'll soon be announcing the date, so keep an eye out on the NARS Twitter feed at NARS Workshop and on our website at nars.org for more information. We're recording this webinar and we'll post it to the website in the days to come. And if you go to the website, you can also find recordings from the 5 previous sessions this summer. And of course, if you're interested in learning more or volunteering within our community, you can sign up at our mailing list in the link provided. And to close, I just want to extend a real deep appreciation to the folks who made this possible. A huge thanks to Hannah Batesh from APT Associates and all of the individuals at APT who are part of putting this together today. I want to thank my co-chair, Asaf Glosser of MEF Associates, who all were instrumental in making this happen. And finally, a particularly huge thank you to our panelists who have been giving their time leading up to the event. I'm really looking forward to the conversation. Back to you, Hannah.
Thanks, Lauren. So we have a great lineup today. Lauren, can you give me back the host? Thank you. Great. All right. So we have an excellent lineup of speakers. So first we have Sungwoo Cho from Apt Associates, who will start us off with an overview of machine learning and how it can be used to answer questions about social services programs. And then we'll hear about the ways that state and local government agencies are doing just that. So Deanna Barrett and Carol Rogers will discuss how the state of Indiana is using machine learning in their workforce development system. And then Ruby Richards will discuss how Douglas County, Colorado is using predictive risk modeling to improve child welfare system outcomes. Before our presenters begin, though, we'd love to know more about who we have in the room. So for our first audience poll question, we'd like to know what type of organization you work for. And you should be able to see the poll on your screen, and I've also projected the answers here. So Jean, is the poll up?
I apologize. I'm having problems bringing that up. If you could put your answers into the chat,
Sure.
And I will bring up the chat screen so that everybody can see that more easily.
Great. I'll read through these. If you work for a state or local government agency, a nonprofit or other community-based organization, a college or university, another research organization, or something else. And I'll give everyone about 30 more seconds to respond. I don't see the chat, but Jean, could you tell me how we're doing on responses?
Yes, we have a number of responses from people, state government, other research organization, federal government, county government. We're getting great responses so far, several universities. And some people are also answering in the Q&A.
Perfect. Okay, so it sounds like we have parts of each presentation that will work for everybody. So then for our second audience poll question, we'd like to know how familiar you are with machine learning. We imagine there's a range, but we'd like to know the specifics. So you should be able to see the answers up here, and again, you can type them into the chat window. So please tell us if you're using machine learning in your own work at your agency or organization, if you're not personally using it, but others in your agency or organization are, if you've heard of it, but your agency or organization is not yet using it, or if you've come here today to learn what machine learning is and how you can use it.
So we're seeing a lot of people responding from the gamut, including I'm here to learn what machine using is, some using it, so some terrific responses. Thank you.
Great. All right. Well, then, now that we know who we have here with us today, Sungwoo, I'll turn it over to you to get started.
Great. Thanks, Hannah. Let me get the slides. Okay. Hi, everybody. My name is Sungwoo Cho. I'm really happy to present on machine learning applications in social policy research. I have been at Apt Associates for over 6 years. I serve as the data science capability lead here at Apt. And so some of my functions at Apt include running the Data Science Fellowship, which is a training program for Apt employees on using data science and applying data science to their work. And I'll talk a little bit about that at the end. And I also host and run these sprints, data science sprints that we have at Apt, which are very quick turnaround endeavors to try to answer machine learning questions. I also serve as a research associate professor at the University of Oregon, where I also apply data science to the different kinds of work that we do at the College of Education. And I also advise senior leadership on student success issues. So before I delve too deeply into machine learning, for people in the audience who might not be familiar with machine learning or want to know what a basic definition of machine learning is, before I talk about machine learning, I should be talking about artificial intelligence, or AI. And it's really used as a large umbrella term that uses any method that categorizes data, often very large data sets, with high accuracy. So AI includes machine learning and includes things like computer vision. So specifically, even within machine learning, it's one of various methods that people use that are under this auspice of AI. So machine learning is a type of AI that, quote unquote, trains data to make predictions. So that data can be in the form of numbers, so trying to predict 1-0 binary outcomes at the individual or unit level. The data can be in text form. So if you want to try to predict what text might be coming down the line, or try to predict categories in which how text are organized, we can also do that using machine learning. And data can be in the form of images as well. So I think that there are many different types of data that we can use with machine learning. So it's not just a spreadsheet full of numbers that we use to try to make predictions. It can be text, it can be images as well. And on the right-hand side of the screen, this is just a snapshot of Jupyter Notebook, which is a pretty popular interface that people use to run Python scripts, in addition to many other languages. But this is quickly becoming one of the more popular, if not the most popular way that people do, quote unquote, do data science using Python, is using Jupyter Notebooks. And you can see that even in the small example here, you have data that are in the form of text, like clearinghouse, labor, transformation. These things are pieces of data that we're analyzing using something called natural language processing, which is a type of machine learning. And that uses text as information. So from a policy research context, traditionally emphasis in policy research has really been on evaluation. So I think for decades now, people have been very interested in whether a program or an intervention or a policy shift is working to improve outcomes or not. And by and large, these types of programs and interventions that we're trying to determine whether they work or not, these types of questions didn't really require very large amounts of data. So you can run a power calculation and quickly figure out that you may only need a few hundred people in a data set to try to determine whether some policy shift that was provided to a treatment group is working or not. So in that sense, for the past few decades, it seems, especially in our policy research field, we haven't really needed to use very, very large amounts of data, because some of the most important questions that we've tried to answer can come in the form of data sets that are 1,000 rows large and maybe 20 columns large. So from a policy context, with regard to machine learning, the real reasons why we want to use machine learning are in instances in which we have very large amounts of data that we want to categorize or make predictions on, and in times in which we don't have a lot of time. So if you have 2 weeks to try to determine whether 4 million records of student disciplinary actions can be categorized in 6 different buckets, you probably don't have enough time or the staffing power to run through and read through 4 million different documents in 2 weeks. So you need to use machine learning to help you run through that type of data in numerical form or text form or in terms of images. In our policy research world, we think that we're still at a relatively early stage, but there's a lot of potential for growth because a lot of our data sources are already available in the form of existing administrative data or large amounts of text information in which, if you go to a site visit, for example, you're keeping notes. And so that type of information can be used in a machine learning context as well. With regard to our work at APT, we want to apply machine learning ethically, and we want to apply it to our current and our future work, and it really blends many of our capabilities here at APT. So what we want to do here is really merge content expertise with machine learning tools. So we're always looking for ways in which we can have subject matter experts combine their subject matter knowledge with machine learning applications. And so we want to help identify the people or the units that are most in need of services and try to assist them in the best way that we can. And we also want to more quickly and thoroughly analyze written documentation to aid research. And so that's where text information is so critical for us. With regard to how this fits in our world, so coming back to 2019, last year, I think I try to keep records, especially during the summers, as to how machine learning is changing or in some ways not. And so I've taken a log of what we used to do even back a year ago. And so I came up with this rubric of how we at APT at least try to think about machine learning. And one is predictive analytics for research, and so improving quasi-experimental approaches by using machine learning to more accurately match across treatment and control groups, or use machine learning for cases in which you have missing data. We've also looked at predictive analytics for services, so predicting people's outcomes and flagging high-need cases based on their historical information. We can use machine learning to now what we think is pretty high accuracy to try to predict whether particular individuals will graduate from college or not, for example. Using computer vision for identification, detecting objects for research. So at APT, we've taken a look at using computer vision to identify mosquitoes out in the field for some of our vector control work. So we're doing things that are kind of outside our quote-unquote usual policy research field, but we think that that's also a pretty important application. And then lastly, we use machine learning for natural language processing so that we can process very large amounts of text very efficiently in a short amount of time. And then, so fast forward to now, what we've seen here, at least at APT, is that we've tended to use more machine learning for predicting individual level outcomes to help determine whether certain individuals will need services or not. So predicting individuals and units outcomes and flagging high need cases. So one of the things that we've done is use machine learning to try to predict whether nursing homes will have COVID outbreaks and using publicly available data for that. And so both at the individual level and at the unit level, like nursing homes, we've been able to use machine learning to try to accurately predict whether certain things will happen or not. And then for natural language processing, NLP, we've been collecting and processing large amounts of text data very efficiently. So as we're doing all these things and applying NLP and predictive analytics, we're also learning quite a lot as well. And this is not to say that we're not doing anything or we're shunning predictive analytics for research. I mean, we definitely do embrace that. And we have some presenters in this session who are talking through predictive analytics for research purposes. It's just that with regard to some of the things that we've used in this past year that we think have been more amenable to certain methods, it seems as though predictive analytics to predict individual and unit outcomes and NLP are quickly becoming things that we're focusing most of our attention to when it comes to using machine learning. So some ongoing machine learning applications. We have a few projects across the company in which we're using predictive analytics to try to predict, for example, high greenhouse gas emitters, and that's an EPA contract that we've had for a while now. And we've also used predictive analytics to try to predict vitamin usage doses using nutritional labels. So that's actually a combination of some of the things that we're doing with text analytics and predictive analytics to try to more accurately predict what dosage should be for vitamins using labels. And then on the NLP side, we've been currently doing some work under a DOL contract to try to identify themes in a very large amount of text sources for career pathways as our subject matter that we're focusing on. And we're also identifying themes in public comments. And so this is another EPA project in which if you have tens of thousands, if not hundreds of thousands of public comments that you're trying to read through, it's ideal if you use something like NLP to try to get a better understanding of it, to categorize public comments that way instead of trying to read through them with like a small staff of people. And then with regard to emerging applications, so we've assembled sprint teams, like I've mentioned at the beginning, that address a specific problem using machine learning within a short time frame. So we're actually right in the middle of one right now where we're using a team of our most qualified data science people across APT, and they're trying to figure out how we can best predict contraceptive stock levels in Cote d'Ivoire. And we're using data, publicly available data from USAID, and it's a USAID funded competition. And so within a 2-week time frame, we're trying to get a sense as to what the data look like, determine what methods we should be using to try to diminish error as much as possible for our machine learning algorithms. And so we're doing a lot of these things and figuring out what works best and what doesn't by doing these things in a very short period of time. And so by Friday, we'll have 2 or 3 machine learning models that we'll try to pick one of those 3 to submit to this competition. So that's a pretty exciting thing for us because not only are you producing things like algorithms that you can showcase, you're also learning a wealth of information as to what works and what doesn't. And then our own internal data science fellowship program now has nearly 140 apt employees that have been trained in some level of data science using Python. And so what we're trying to do again is merge the subject matter expertise with machine learning expertise across different methods and different levels. And the way that we see it is that data science is now becoming so commonplace that as many people as possible should be conversant in it. And we also really want to keep equity in mind as well. So we really keep a very stringent eye on gender breakdown and race breakdown in our data science fellowship cohort as well, because we want as a diverse set of backgrounds and ways of thinking about data as much as possible, and we try to funnel that into our data science fellowship program. And I believe that this will be my last slide. So in terms of emerging machine learning applications for us, again, I've talked about the COVID outbreak work that we're doing at nursing homes using publicly available data. And we're also trying to predict child permanency outcomes using publicly available data from ACF, this AFCARS data that's available. And again, we're right in the middle of trying to predict contraceptive stock level and usage in several African countries, including Cote d'Ivoire. And with NLP, we're trying to determine themes from COVID literature. And so we were a part of another sprint in a competition in which we went through 40,000 journal articles that had to do with COVID or some sort of respiratory disease. And so we gave ourselves 2 weeks to run through all of that information. And we ended up learning a lot about what the main themes were in terms of this type of respiratory disease literature. And we also produced some tools that help us more efficiently parse through that data and visualize that data as well. And lastly, with regard to determining bias in administrative data, this is one of our newest emerging applications for machine learning, where we're trying to use machine learning algorithms to try to determine the extent of bias, whether it's gender or racially based, that are available in an existing administrative data set. And so we've done that using AFCARS data again to use this algorithm that was developed by IBM called AI Fairness 360. And so we've incorporated that into our Python algorithms, and we try to determine the level of bias that's already baked into some of these administrative data sets. So I believe that is it for me. If you have any questions at all, or if you are interested in anything that I had to say with regard to machine learning and how we think it should be used in a policy context, feel free to reach out to me. And so thank you for your time, and I'll pass the baton over to Diana.
Right. Thank you so much, Sangwoo, for this interesting presentation. My name is Diana Barrett, and I am the Assistant Director of Research and Analysis at the Indiana Department of Workforce Development. And we will be talking today, along with our partners from IVRC, about a product that we have created, which is the Occupation Assignment Engine. So DWD and IVRC are long-term partners in labor market information and research. So today we are going to talk about how we actually use machine learning to assign occupations to wage records. So we have the Occupation Assignment Engine, and my partner from IVRC, Carol Rogers, is going to talk about the actual product a little later, and I'm going to give you a brief overview of why this work is really important for us in Indiana. So one of the reasons, the main reason why we decided to partner and start collecting occupation data is because that data are currently not available on the administrative level. So that does definitely not mean that we don't have any occupation data available for Indiana's employees, but that data that we currently have comes from either surveys or is self-reported in many cases, which, while it gives us a lot of insight and it tells us a lot of information, it is actually not as reliable as administrative data. So that was kind of our motivation why do this. And occupation data is crucial in understanding just our general economy and the workforce in a more granular way. So right now, what we can tell mostly is if somebody is working in the healthcare industry, but what we cannot currently tell is whether they're employed as a cook or a nurse. And that difference can be really important in terms of analyzing the data. So with the help of Workforce Data Quality Initiative grants we have received back in 2017, we are able to create an infrastructure and basically an ecosystem to start collecting occupation data directly from employers. So currently, Indiana's employers are reporting occupation codes along with their quarterly wage submissions. Ideally, what we plan in the future is to have every employee in Indiana with an occupation code assigned with their wage record. And right now, with quarter 2 of 2020, and we have started in quarter 1, 2019. So right now, we have about 50% of Indiana employers reporting occupation codes, and that means that about 42% of Indiana's employees have an occupation code assigned with their record. So we are continuing our efforts to work with employers so they continue to provide those occupation codes to us. Occupation data is definitely something that is not only interesting for LMI shops within the state government, but we get questions about occupations from researchers that are based at different universities, mostly evaluators of federal programs, or just the general media. So what we are hoping to do with the more complete occupation data we are currently receiving, and these here are just 2 basic examples, is a link with education and corrections data. So we have access to education data, and with the occupation records we are collecting, we will be able to see whether people are working in occupations that are aligned with their education. And that will also help us understand what is the number of underemployed people and which industries or occupations or education backgrounds they come from. So it will help us also look at the possible wage gains by occupation within the major of study and industry of employment. So, for example, we will be able to see what occupations employ English majors that are not only traditional employers, such as the schools. So we are hoping that out of this, a lot of interesting research projects will come in the future. And of course, another important link we will be able to make is understand what occupations and what talent pipeline comes from Department of Corrections. So these are just 2 examples that are probably representing the most common questions we get about occupations. So we kind of have a feel that once we have all the occupations in the system, this will be widely used by the general public, of course, as well, even if it's out of curiosity. So I mentioned earlier, Indiana Department of Workforce Development has not been in this process alone. We have had a long-term partnership with the IDRC. And as you may know, sometimes it is really challenging for state agencies to have access or time for cutting-edge computing capabilities. And a lot of the times we have enough staff resources to cover daily operations, and anything that's kind of outside of these boundaries for any external projects, we have to really think about assigning staff to these projects. So with this partnership, we are able to dedicate staff resources to different special projects and also share our knowledge, share expertise. And this partnership has really allowed us not only to receive assistance in terms of work and work activities that need to be done, but we are also ensuring we are sharing that knowledge, and we are also providing upskilling opportunities for our staff, and that's on both sides. So, for example, we are able to learn from IDRC about different research results, different new methods of research, and what we can provide in return is a deeper understanding on how the government works. So, again, this has been a long-term relationship that we've had multiple opportunities to capitalize on, and we are really a great team. So with this, I will invite my teammate and partner, Daryl Rogers, to talk about the actual occupation assignment engine and how that works.
Oh, thank you so much, Deanna. And if you can pass there you did. You passed the ball over to me, or hot potato, whichever one you want to call it. Good afternoon, everybody. And Deanna and I are so pleased that we were invited to participate on this panel. And so I want to give a shout out to NARS as well as ABT for including us in this. We have had, as Deanna mentioned, a long-term relationship with our state workforce agency. And my research center works with many state and local agencies around data-powered research, and we try to apply as much technology and appropriate approaches to this as possible. Sung, I was interested in your earlier presentation about the work that you're doing with the Department of Labor on career pathways, because fundamentally what we want to do with this occupation assignment is to feed into the whole career pathway understanding. How do people get, as you mentioned, Deanna, from being an English major to, say, a data scientist? What is the career pathway that they took? We also want to be able to understand where there were bumps in the road for people, and eventually I think Deanna used the data to help us with kind of early warning signs about particular occupation types in particular industries. So it's really exciting research, and where we started was to pull in as much direct information as we could. And when we talk about direct information, or in this slide, direct assignment, we're using unemployment insurance claims because they capture the occupation of the unemployed person. We're using survey data from the occupation employment estimates that give us staffing patterns, because one kind of occupation, let's say data scientist, could be working in different types of industries. So data scientists are now working in manufacturing, they're working in technology industries, but also in nonprofit areas. So being able to see new and emerging occupations, as well as understanding which occupations may be heading toward that of buggy whip makers. And so all of that helped. We also, in Indiana, have access to two exciting databases. One is professional licensing, which is a consolidated licensing data set, and also public employee database. So we get about 600,000 public employee records every year, where we built a concordance between what, say, the school or the local government agency calls a particular kind of worker, and crosswalking that to an official SOC code. So these are all direct assignment where we have, 80 to 90% certainty on the job title. But then we have the 2.5 million more wage records that did not have an assigned occupation title. And so that's really where the machine learning techniques came in. Using all of this data, the professional licensing and everything that we could grab, because machine learning works really well with huge amounts of data. Using that and the indirect assignment, and then going quarter by quarter by quarter by quarter of wage records, we were able to introduce machine learning algorithms that would help us make assignments to the unassigned records. So what we began with in terms of the concept was to turn it into an input tranche. And so all of these icons that you see here, and it's a little too small for you to see on your screen, but that doesn't really matter. Really, the important part of this is that we have all of these inputs that we're running through multiple processes using the supercomputers here at Indiana University to run through the algorithms over and over and over again, and where we're training the data in order to make more and more precise assignments to the wage record. And so we're using, as I mentioned earlier, some really large data sets. And I just wanted to give you a little bit of insight into the licensing data that we have that cover the health industry. So we've got registered nurses, doctors, veterinarians, therapists. That's a very large portion of it. But we even have bartenders. We have the people who work for landscaping companies when they're coming to apply chemicals on your lawn. They have to have a particular kind of license to be able to do this in the state of Indiana. We also have engineers, help me out here, Diana. Let's say beauticians. That's easier for me to say. But barbers.
Cosmetologists?
Yes, thank you, cosmetologists. Plumbers, pipe layers, accountants. And so all of that information is helping us be more precise, but it's also, most importantly, frankly, for machine learning, it's giving us training data so that we can, the algorithms can begin to recognize that it is this occupation, not that occupation. And for some reason I can't go, there we go, my next slide. So just giving you a little bit of insight into one small piece of what we're doing in terms of taking the training data from our microdata, the employment estimate sample, and we provide the input data, we run it through a national staffing pattern, it goes through the process, but then we also pull in wage records with their NAICS codes. The amount of money is really critical, we learned, to the process, because the wages can be a differentiation between a licensed nurse, an LN, and an RLN. And so using the wage data, we learned, as the machine learned, would be an important dividing factor in terms of specific occupations. And again, part of this is, as Sung pointed out earlier, is that we're talking about massive tens of millions of records of data that are being analyzed and essentially taught to begin to recognize and predict what sounds so simple, an occupation code. That's all we wanted out of it, but we need to do it over and over and over again. And so the machine learning, again, is coming through in terms of both handling the vast amounts of data, learning which ones are important, which data elements are important, and which ones aren't. But we're also using it then to make the selection of the SOC code, the standard occupational code with the data. And so we've developed actually multiple predictive modeling processes. We apply it, we validate it, we assign a strength measure to this. So as part of the process, we're assigning a code from 1 to 10, 1 being the least reliable, 10 being the most reliable for that actual assignment. The other thing I wanted to mention too is that the wage records are available on a quarterly basis. So every quarter there are 3 million records for that particular quarter, and part of this process is also then creating a longitudinal system. And Sun, I think you'll be interested in this, a longitudinal system so that we can also see what occupation a person has had over, say, the past 10 or 15 years. So we're making the assignments not only going forward, but also going backward in time. And then there's a term that our lead researcher on this, Tim Slaper, likes to use, which is actually rinse and repeat. And so we're doing this over and over and over again. And it makes it sound really boring, but that's why the machines are really good at it. So some of our next steps are to keep on top of machine learning techniques, always being watchful for what others are doing. And then we're also going to pivot the assignment engine to apply validation procedures to what employers are submitting, because they may be in a hurry when they assign occupation codes, right, Deanna? So we have to go through and use the engine soon to start validating those 42% of employer-submitted codes that we've gotten since, I think, the third quarter of 2019. Is that right, Deanna? When did they start submitting?
We launched with Q1, so in Q2 they had reported for Q1 2019. So within about 6 quarters in.
Yeah. So now we need to actually check their work. Trust but verify. Did I miss anything there, Deanna, or others on the panel? All right, I think we're good.
Yeah, in terms of occupation codes, I think you covered everything, and thank you for making those connections with the previous presentation. And I think that the joint work is going to be really important. So I'm very happy that we are also moving into applying machine learning techniques for services rather than just for research.
Oh, absolutely.
Good afternoon, everyone. My name is Ruby Richards, and I'm the Deputy Director of the Department of Human Services in Douglas County, Colorado. And just to level set a little bit, Douglas County is a suburb to the south of the Denver metro area, and we have a population of roughly 388,000 in our county. And so we have been on the journey of using predictive risk modeling for about 4.5 years now within our work in child welfare. And so I just wanted to take the time this afternoon to explain to you how we developed our model and where and how we use it. So what is predictive risk modeling? I think Sungwoo did a good job of explaining that on that high level academic version, and I'm going to bring it down just a little bit to what it looks like in child welfare on the ground. And so what we did is we used data that is already collected about each child to evaluate what is the possibility of future adverse outcomes for them. And so oftentimes people would ask, well, why are you using predictive risk modeling in child welfare? And part of the reason is that we have such a vast amount of data available to us that it is hard to make sense of all of that, quite frankly, in a short period of time. And I think that the other presenters have really demonstrated that when you're trying to deal with large amounts of data and a human is trying to analyze and figure out what the story is with all of that data, that's difficult. And so the other nice piece about using this is that we're able to use it in real time and to do retrospective analysis as well. And so looking at what's the current situation for this child and family in front of us, but what have we known about them historically? And as I said, it's difficult weighing all these factors, especially when we are working with a family who has maybe been known to the child welfare system many years in a row, or sometimes generationally, that we're looking at lots of information that's very complex, and our time to analyze that just by reading records is scarce. And so our hope is that we can also decrease bias in our decision making. So oftentimes we see when we are reviewing referrals that have come into us of whether or not we should assign a caseworker for an investigation, is we have casework staff who knows the family, who has worked with them before, who has been involved with them before. And so, they are bringing their own personal bias and professional bias into the discussion of whether or not we should assign a caseworker to meet this family and work with them again. So just to give you a little sense of kind of how we came to be here, the little graph on the left-hand side with the bubbles really just shows the path that we took to develop the model to use in making screening decisions. And so the first step, we just needed to understand our data. And so as we developed this, our researchers used data from our TRAIL system, which is our CWIS system. So it's a Child Welfare Case Management System, and we used the basic referral level information, so the information that came into us today, say, what was the call about, what's the demographic information for the family. We then used client level information, historical. So we looked back through our system and determined, has any county in Colorado interacted with this person before? And what did that look like? So some of it very basic as to age and gender, some of it as to were they previously known as a victim, were they previously known as a perpetrator, were they previously known just as a household member. We then look back also at what the referral outcome or disposition was. So with referrals, that's the information that comes in through our hotline. We basically have two options. One is we're going to screen that out, and it does not meet criteria for a caseworker to knock on the door to investigate or assess allegations of abuse and neglect based on our state statutes and rules. Or we are going to assign it and send a worker to meet with the family and determine how we might be able to assist. The other piece of data we looked at was assessment information. So once a referral becomes assigned for a caseworker to go out, that then becomes the assessment phase. And so when we were looking at that information, we were looking at what was the disposition of that assessment. Did we confirm that child abuse or neglect had occurred in that situation? We also used CBMS, or our public benefits data, and we again looked at it from the client level, who all was enrolled in benefits, and then we looked at it from the eligibility or the benefit program participation. So which program did they participate in? Did they receive SNAP? Did they receive Medicaid? Did they receive both? Did they receive TANF? And so we look at all of that. We also look at were they ever under investigation for fraudulent use of the benefit system? And then the final thing here is the Douglas County HS Cares, which basically is a master client index that we had developed several years prior to taking on the predictive risk modeling. And really it allows us to track households across services. So did this particular client receive child welfare services as well as financial assistance services, or one or the other? So what was the problem we were trying to solve? And really it's highlighted here at the very bottom, which is we have to make very difficult decisions that are subjective. And so how can we take some of that subjectivity out? How can we maximize time? And how can we make the best decisions possible? Prior to using predictive risk modeling or machine learning, and still continuing today, we use a process called RED Team, which stands for Review, Evaluate, and Direct. So you'll see in the bubbles at the top of the slide, a citizen calls into our hotline with concerns of abuse or neglect. A referral is generated, and then that referral is reviewed. And that referral is reviewed in this RED Team process. That RED Team includes 2 casework staff and a supervisor. And they're responsible for analyzing the current referral, the one that was recently called in to us, all of the child welfare history that's in our case management system. We also then access the criminal history databases for our state, and then we also can access our CBMS or eligibility system to determine whether they are also recipients of food stamps, Medicaid, or TANF. So that was the process that occurred before the machine learning, and it is still the process that occurs. What we have to do is we have to make a decision at that point in time. Are we going to assign that referral, which means sending a caseworker out to meet that family, or are we going to screen it out, meaning that it doesn't rise to the level of an allegation of abuse or neglect and does not meet our statutory authority for becoming involved with a family? So next I'll show you where the machine learning fits into this RED Team process. So what we did is we developed, or our researchers developed for us, a risk score on a scale of 1 to 20. So the bottom portion of the score, the child scoring 1, is in the bottom 5% of risk. And the risk that we were measuring is what is a child's likelihood of entering out-of-home placement within 2 years of the referral we received today. And so if they're receiving a score of 1, they're in the bottom 5% risk of that happening. If the child receives a score of 20, they're in the top 5% of risk of that happening. And at a score of 20, they're about 48.6% chance likelihood that that child will go into out-of-home care at some point within the next 2 years. So how did we develop this score and how are we using it? So we partnered with the Auckland University of Technology in Auckland, New Zealand, with the Center for Social Data Analytics and Dr. Rima Vaidyanathan. What we did was we shared all of our Colorado data, so our state CWIS trails data, our CBMS data, and then the research team analyzed all these factors that would help us to determine which ones would tell us had the most predictive power of determining a future maltreatment event or the likelihood of out-of-home placement. So what we chose to do was start at the front door, and AUT University also developed the decision aid for Allegheny County in Pittsburgh. And so we followed their model and said, let's start at the front door. How can we try to intervene with the right families where the kids are highest risk of out-of-home placement and not have government intrusion where we've got children who are scoring in the lowest risk? And so we decided to start at the referral disposition or at that decision point. We've said all along that this is an aid in our decision making. In fact, we call it the Douglas County Decision Aid. The machine or the tool does not make the decision for us. but it is one more piece of information in our toolkit that helps to guide us. And so we spent a year doing a random control trial evaluation. And what we did was we randomly selected referrals each morning when we were going through that red team process, where half of them would see the risk score and half of them wouldn't. And what we wanted to see is, did we make better decisions with the use of the decision aid? So were we intervening less with families that were scoring in that low 5%, and were we involving ourselves where we could make a difference and hopefully prevent removal of children into out-of-home placement? And we ran that trial for a year, and the results were just finalized, or in the process of being finalized, but we have the results in early August, which said that we did in fact do that. We saw less assignment of those in the range of 1 through 10, and a greater increase in assignment, and statistically significant in that range between 15 and 17. So going on here, we also developed this, again, looking at 300 pieces of information, and then that was built into the model. And again, I had already mentioned that this was to look at what's the likelihood of a child going into foster care within 2 years of the focus referral. And keeping in mind that the data included in the focus referral, other than demographic data, is not looked at, because at that point in time, it is simply a referral. We don't know if the information is true or false. And then to give you an example of what it looks like when we're in the process, this is what our risk score looks like. So the team, as they're reviewing all of the information, will pull this up on their computer using Power BI, and it gives them that placement score. So you see here on the left-hand side the gauge, which says this child is scoring a 15 in the likelihood of entering out-of-home placement. On the right-hand side, we wanted to make sure that casework staff and supervisors always were mindful of what that 15 meant, and that we never lost sight of that. So you see down there that the score of 1 is really right at 0.1%, 0% chance of likelihood of entering an out-of-home placement. For this particular child who is scoring a 15, we're looking at that likelihood being right around 12% likelihood. Had this child scored a 20, you'd see that it was right up there near 50% likelihood. So that is how we are using predictive risk modeling in our work in child welfare. We are just now getting ready to start on the path of how to use this similar score with supervision. And so knowing that a supervisor of several teams of caseworkers has anywhere from 200 to 300 cases that they're responsible for as they oversee their teams. And what we want to be able to do is keep the supervisor focused on which are those more high-risk cases that we really need to be checking in. We really need to be making sure that when we are doing supervision with our staff, that those are the ones that are getting time and attention. And then alternatively, which are the ones that are starting to score lower, and what can we do to begin to end our involvement with the family? So that's what is to come, and we're super excited about that. So thank you all for your time and for allowing me to be part of the panel. I believe I'm sharing it back with Hannah.
Yes, thanks, Ruby. All right, well, thank you to all of our presenters. I think we had a really great and interesting set of presentations, and we have plenty of time for questions. So I see that some people have already been typing questions in the Q&A window. Anyone with questions, feel free to add your questions there, and I will read them aloud. So I will start with one that is logistical. Somebody is interested in whether we will be sending slides from the presentation following the call. Yes, these slides will be posted by NARS, and anybody who registered for this webinar will receive a link to that landing page after the webinar. And then our first content question here, I believe this is for Ruby, but Gianna and Carol, you may want to answer as well. Based on your experience, what algorithms are best for populating missing data in records with predicted data for these data elements?
I'm going to punt that to Deanna or Carol. I'm more on the practice use of this versus the development use of this.
Makes sense. All right, Deanna or Carol, do you have thoughts on which algorithms are best for populating missing data and records that have predicted data for those outcomes?
Well, not off the top of my head, no. And I can go back to our team to pull together a group of algorithms that we have found that we've written or modified. Sung, do you have any advice on a good location to go to? Kind of best practice for matching? We use a lot of different ones, so I really can't nail it down to one. And a lot of times our experience is you need to use more than one. Take more than one approach or a single algorithm. It's usually multiples. So that probably doesn't help you, but.
Sungwoo, do you have thoughts?
Yeah, I mean, I echo that there's not going to be one solution because you have to figure out what type of variables you're working with, like what type of matching you're trying to do, what your end goal is. Stack Overflow is always a great place. Katie Nuggets, if you want some advice on what other people might be doing with anything data science related, that's usually where we go first when it comes to trying to resolve these types of questions ourselves.
Certainly for matching algorithms, there is a huge amount of information out there. I think SAS has a really nice portal for that because they've gotten big time into matching. If you're thinking about matching in terms of names and locations, high schools, things like that. But Sung is spot on. It depends on what data you have and then craft the algorithm around that.
Mm-hmm. All right. I'd encourage people to keep typing your questions into the Q&A window while they're coming in. I wanted to ask, Sungwoo, you mentioned at the beginning the importance of equity considerations in designing the Data Science Fellowship Program, and I heard both Deanna and Carol and Ruby echo that as well. I wanted to give each of you a chance to talk a bit more about the equity issues that have come up in your work and how you've addressed them.
It's a really good question. I mean, my general stance has been we need more women and underrepresented minorities in data science, period. It's been a pretty homogenous group of people who have been in data science, working in data science, developing algorithms in data science for a while now. So the types of things that we come across and the types of questions that we're trying to answer really lend themselves for as a diverse background of experiences as possible. So that's reflected in the makeup of these sprint teams or the makeup of the data science fellowship. It has to be as diverse as possible so that we can create algorithms that that best serve to answer the types of questions that we're trying to answer, especially when it comes to like social policy questions. So yeah, that's just my general stance on this.
All right. Deanna or Carol, anything from Indiana on equity considerations in your work?
No, I think Sung covered it very well.
Yeah, I would agree. And I actually think that looking into the occupation data and going a little bit further in history, as Carol explained, it may give us a good overview. And I know there have been some national efforts and kind of nudging people of different profiles to consider a career in one direction or the other. So actually looking at those historical data, we may be able to nudge more quote-unquote non-traditional people in the machine learning. And especially I think it's attractive to a lot of different populations now that it's not tied to research exclusively, but we see many more applications of it.
Yeah, and I
Ruby,
think
any
that's
thoughts
a good
from?
point about I'm sorry. Well, just a really good point about having large data sets that also cover large periods of time. I'm a particular fan of 20, 25 years worth of data, especially for what Deanna is talking about, if we're able to look at the occupations in light of who has been systemically kept away from certain occupations, and is there intelligence that we can pull out of this that helps us understand better the barriers.
Mm-hmm. Thank you. And Ruby, any thoughts from Douglas County?
All I would add is really just with regard to the building of our model, is that we did run our model both including and excluding race, and did notice that there was no significant difference when race was excluded. We are continuing, especially as we develop this supervisory tool, to continue to look at that more, as we know that there is implicit bias throughout the child welfare system. And so what I would say is in Douglas County in particularly, we see a slight overrepresentation of Hispanic families in Douglas County. And so we're continuing to look at that and try to pinpoint and figure out where that is coming in and what we can do about it. But one of the other things is that oftentimes, because we're using referral data that's coming into us, the bias is coming in with the report itself.
Mm-hmm. All right. I would encourage people to keep putting questions in the Q&A. Our next question for all of our panelists is, can you talk a little bit more about some of the challenges you've encountered in your work and some mistakes that came up early and how you've addressed those? I think, we all have a sense of how iterative these processes can be, given that the data aren't perfect. And so sort of pulling up the hood a little and telling our participants a little bit more about the, things that went wrong and how you addressed them.
I don't mind tackling this first, just to talk about how we made a lot of mistakes when we started incorporating machine learning, but like machines, we were able to learn from them. So not only were we trying to train the data and then allow it to inform us, we also had to work harder to get better metadata about what we were using. And probably one of the biggest challenges that we have today is that there is tons of data available and not much data about those data. Where did it come from? How was the question asked? I see in the chat box that there are questions about bias and implicit bias. Understanding how the question was formed when the person was filling in the blanks for their unemployment insurance, for example, or how employers are answering the question about something related to their company, all of that ultimately is going to affect this. And so we've had to learn a lot more about the data itself and how it was collected than ever before.
Thanks, Carol. Anybody else? Okay, we have a ton of questions, so I will ask one that, Ruby, this is for you. How is the algorithm refined over time as more data become available, or what's the learning aspect of the machine learning?
Sure. So again, I'm not the technical side of things, but what I would say is that as the data changes, so let's say a child or family becomes, time passes and we've had more involvement with them over time, the score will change. So because there are over 300 risk indicators, some of those are looking at how how many child welfare referrals have you had? What were the findings for each one of those? Has the number of children in the household increased or decreased? And so over time, you could see that risk score go up or down depending upon what has changed.
Thanks, Ruby. Sung-Woo, this next question is for you. Is machine learning completely agnostic about theory and which direction the causality runs? So occupation and wages, and would a well-performing machine learning algorithm ever be rejected for other reasons?
That is a really good question. I'm not even sure if I can do it justice. In terms of the causal question, so I don't know if I'm going to address this the way that I think the whoever asked this question had in mind, but when it comes to causality, and might be a controversial statement, but I think using RCTs is still the gold standard for determining causality. So from what I've seen, I mean, people have tried to incorporate machine learning into causal methods, but I think that for a broader audience of policy-minded researchers or policy makers, I think they still hold RCTs to the highest standard. So long story short, I'm not entirely sure. As of like summer of 2020, I'm not entirely convinced that machine learning is going to appropriately answer and tease out causality questions the way that RCTs can.
Thank you. We have another really interesting question. How does the COVID-19 pandemic affect your prediction models, if at all? So I think Carol and Deanna would love to hear about how this is playing out in Indiana, and then Ruby, hear from you about Colorado.
Well, first of all, we have just recently received the preliminary version of Q2 of the wage records. So my short answer is we don't know yet, but we are prepared when we start running the algorithms on the second quarter, which is April, May, June, which was certainly then capturing huge job losses. We probably won't know the full effect until we get through the summer and get another 2 or 3 quarters to see what we anticipate to be significant job shifting. And that, again, is why the having multiple quarters. Sorry, that's my dog barking. It's the mailman. So we need to get through a couple more quarters, but we certainly are anticipating what we have already seen anecdotally through the department's work through the unemployment training programs, the job matching and all of that, where we've seen, for example, an interesting shift from hotel workers to working in testing labs. And so we're going to have to look at the results and begin to analyze those outcomes to understand the big changes.
And just to add to that in terms of collecting soft code data from the employers. So while it's great for us as the state agency, and we see so many potential uses of receiving the soft code data from the employers, for the employers, it's just another thing that they have to report. So we have seen a little bit of a drop in terms of soft code reporting. So over the past 6 quarters, every quarter we have had more employers report more soft codes for more of their employees. But of course, during the pandemic, people had employers, especially small employers, which are the majority of employers here in Indiana, they have had other issues that were a priority. And soft code reporting right now, we are not penalizing people if they don't report soft codes. So yes, we are prepared to deal with less than number of soft codes reported in this quarter.
Great, thank you. Ruby, what about you?
So what we've been seeing is, I think as you've heard nationally, there's been a significant drop in referrals that have come into child welfare, child protection hotlines. Primarily that's mostly been due to the school closures and school shutdown. We often see a drop in the summer months anyway, but that has maintained for much longer than normal. But what we have seen is an increased risk score. So those referrals that are coming into us are scoring between 17, 18, 19, and 20. Many of those referrals are now coming to us from law enforcement, emergency rooms, and so it goes to reason that the kids who are being seen and that we're getting calls about are the more high-risk kids and youth, because those reports are coming to us again from law enforcement and hospital settings. So that's been the most marked thing we have seen since COVID. What I would say is that there's been some conversation too about seeing the diminish of the lower risk scores, the 1 through 5, has been an interesting conversation with our school district and other mandatory reporters about, are you calling in with an incident of abuse or neglect, or are you calling in and seeking support services for a family? And so how can we maybe develop or think about a warm line, is what I'm calling it, versus the hotline for child abuse and neglect, but a way to connect families with prevention or early intervention services. So the COVID has taught us something, and we're continuing to look at that and figure out how to best meet our citizens' needs.
Great, thank you. So I'm going to break one of these questions into two because I think some of it is applicable across all these presentations. So first I'm going to ask, what about interstate data? Do you have access to that as people move, across labor markets from Indiana to neighboring states and across child welfare systems from Colorado to neighboring states?
I don't mind taking that first. We do not have access across states. We do have access to data within the state. So the trail system and the CBMS system, we can access data from any county in the state, but we're not able to access outside of the state.
Okay. Carol or Deanna, what about Indiana?
We do have access to data from additional states. The state of Indiana participates in a couple of cross-state data sharing networks. We have not started to use the occupation assignment as part of that, but we have shared the work, the models, and the algorithms. Deanna, do you have more on the Coleridge initiative?
No, nothing yet.
Okay. But the idea with the Coleridge initiative, and you guys can Google that, is not necessarily machine learning, but machine learning is part of some of the work in sharing the data through a common system. I don't know how many people might be familiar with that. And the idea ultimately is that each state is not only sharing its data, but sharing its research and coming together on a common, I'm calling it research, but forgive me, I really think of it as applied work that's going to help people on the ground, not just airy-fairy kind of stuff, although I could go all day on that, but research that actually is going to help people in the field and help workers, frankly, make decisions about their next job move or career move.
Mm-hmm. All right, our next question, Ruby, is also for you. So what types of predictions come from CBMS? Is that benefits utilization? And then what score is associated with that information from CBMS?
Sure, and the score isn't particularly tied just to the CBMS data. It takes, again, all the 300 plus factors all together. But what we found is that utilizing CBMS, so utilizing SNAP or Medicaid or TANF, is actually a protective measure. And so we saw it help bring the score down. Sometimes, though, in instances where we saw that there was a sanction for misuse of TANF or Medicaid or other benefits, that would then raise the score. So again, it's how it all factors in together. It's not just having utilized benefits all by itself doesn't create a score. It's how it interfaces and how it combines with all the other factors. But we did see it as a mitigating when families who were eligible were utilizing benefit services.
Okay, thank you. And then Carol and Deanna, we have one specifically for you. Has the use of machine learning been tied into predicting the probability of exhaustion in the WPRS processor program? So that's, you'll have to help me out here, worker profiling something.
That is a great question. No, the short answer is no, it hasn't to my knowledge. However, we are undergoing a comprehensive evaluation of our reemployment services, and this kind of comes in timely with the effects of COVID. So right now what is being done is some predictive analytics, of course, but we are considering different routes to move forward to make our program and detection of those people who may exhaust the services, so we can actually have better predictions and better, in return, to better serve the population that is in need of those services.
Thank you. Ruby, we have another one for you. So going forward, do you expect to change the curve as more data comes in and or as the risks are changed either due to intervention or to situations that happen in children's lives?
You know, certainly that is our hope, is that we can intervene sooner and prevent kids from having to go out of home placement. So part of the research with the random control trial is the researchers then will hold this information and 2 years from now take a look back and follow what happened with that child. Did they end up in out-of-home placement, or were we able to intervene soon enough and with the right interventions to prevent that from happening? The other piece that we're looking at is how can we take those lower level risk scores, those 1 to 5s, 1 to 9s, and develop partnerships with our community folks to have them reaching out instead of, again, the heavy hand of the government coming in, but how can we connect them sooner to our support services that are within our community? So we're trying to develop early on prevention, and rather than assigning those, but then keeping our casework staff for those higher risk scores, you know, where we really want to prevent the worst things from happening.
Thank you. So when we have one that, I think for you, it's a very high-level question about machine learning. Can machines learn and create algorithms for predictive modeling themselves, or do humans always have to develop the algorithms?
As far as I know, no. As of now, yeah, that's a loaded question. With the short answer is no. From what I know, from what I understand of machine learning and developments now, we're not having the algorithms create algorithms to the extent that we can trust those types of algorithms. I think that would, that would get into like artificial general intelligence, which is, it hasn't been developed yet. It's like a way in which machines are actually thinking and making decisions really as humans would, and that is something that many people think is either like decades away or is not feasible. That's the best that I can answer that question.
Okay, so everybody who's currently being trained in data science will still have a job as a human. All right.
In our lifetime, hopefully.
I think so, and I guess I want to just second what Sung said. You know, I look at machine learning as a huge aid in analysis, but it is not the analysis. It's aiding our analysis, but it's not actually making the decision, just as Ruby made. We still need people.
All right. And then our next question is, I think it could be for either Ruby or for Carol and Deanna. any efforts to apply modeling, in particular efforts to use predictive analytics for coordinated entry or assessment efforts, so sort of on the front end?
I'm not aware in our state for social services or employment and unemployment benefits that machine learning is being applied yet. I do suspect that it's around the corner. What about you, Deanna?
Yeah, I would definitely agree. I think in recent years we have become more aware of different applications of machine learning, and it takes a little bit of time for people to kind of digest that and understand all sorts of different ways they can go about it. But no, I'm really not aware of any at this point.
And I would say, if I'm understanding the question correctly, that that is what the tool does for us, is it helps in our decision of whether to respond to a family. And so whether that family, I guess if you'd say, is entering into the child welfare system. I'm not sure I'm understanding the question correctly.
No, I think you've answered it correctly. Okay. I'm looking through. I think most of these have either been answered directly or answered. Oh, one last one. So are teams able to change their suggested response after viewing the score? Or is that only revealed after a final decision on whether to accept the report has been made?
Well, you kept me from having to type. Thank you. Yes, they are able to change their score. Again, it is just another tool in the tool belt. And so I think the same person, or maybe someone else, had asked the question about what kind of training did we provide to staff as far as how to use the score. And really that is how it was designed. Is so we gave a similar training to this one to give them the background of how it was developed and what it means and what the score actually means. And then we spent a fair portion of the training actually walking through simulations. And so we took old referrals and we looked at what was the decision that the red team made. When the team makes their decision, they have a framework in our case management system that they fill out. So all of the discussion is captured in that framework. So we took old referrals, we looked at what the decision was made, kind of recreated as best you could what the discussion was, and then we showed the score. And so we had a conversation about, did the score sort of line up? Is it what you thought it would be? And oftentimes the answer was yes, that's kind of what I expected it to be. But sometimes it was way off. So there would be times that they would be saying, yes, we need to assign it and send a worker out, and then we'd reveal the score, and the score was a 1. Sometimes that is because our statute has certain indicators in it that require us to go. So if we have a child, for example, who has a bruise, say on their arm, and they tell the teacher that this bruise came from my mom hitting me, that requires us by law to go. So the score at that point doesn't matter, so to speak. We're required to assign that. So sometimes it was, you understood why we were making a decision different than the score. Other times you'd see people want to screen it out, but then when they would look at the score would be 17 or 18. And what we ask them is that the score doesn't have to change your mind. What we want the score to do, though, is slow you down a little bit and look back in that history to try to figure out, why are we missing? What's different here? Why were we saying screen it out, but the score is indicating to us that maybe we should do something different? And so have further discussion, go back in the record and try to figure that out. And what we have found is that sometimes we're already open with that family. So a new referral is coming in on a family that we're already involved in and working with. And so it's scoring high, but we may not be assigning it new because we already have a caseworker involved. So there would be times that a high score gets a screen out. So hopefully that answers the question. But again, we've trained very consistently all along that it is just another tool. But if it's not lining up with what your discussion said, hit pause, have further conversation, look more into the record, and see if you can find answers to why they're not lining up.
Great. Thank you, Ruby. I think that's a good note to end on. We're just about at the top of the hour. I want to thank all of our panelists for a really interesting set of presentations, our audience for really interesting questions, NARS for the opportunity to host this webinar, and Jean for keeping everything running with all the technology as we've been doing this. So thank you, everybody. Have a great afternoon, and you will receive an email afterwards with a link to the slides and the recording.